And the nutritional status of women and children in resource-poor environments, of course, are particularly critical. And while I was in Africa this summer after those degrees in Ethiopia and after seeing the unbelievable work that Warren and Rob Peck and Dan Fitzgerald and others are doing in Tanzania, I had a chance to visit a colleague in Rwanda who I'm going to talk about in a moment, and had a chance to visit the Partners in Health clinic in Ruwinkwavu, Rwanda. It's very, very impressive that they have in their service delivery in one of the epicenters of the HIV/AIDS epidemic, have linked training in nutrition as part of dealing with infant and childhood malnutrition. We went out on house calls, I guess you could call it, with the nursing and medical staff. And one of the things that was so breathtaking was visiting one woman in a village called Nkondo in the northeastern part of Rwanda. And children had severe malnutrition of a variety of bases, including hypovitaminosis of various kinds, and no chance to, in the system the way it is now, although there's enormous changes happening in Rwanda, no way to have multivitamins or supplements broadly distributed. And so what they're doing is giving tools, seeds and tools to grow kitchen gardens, training them, and then going out and seeing how the garden is faring and choosing the things to be planted based on the nutritional needs of the family. And we saw one success story, a very, very, very interesting success story this summer. I want to talk a little bit more directly about capacity building in higher education, more broadly than capacity building in medical education and medical discovery. And I want to talk about this initiative, the Africa-U.S. Higher Education Initiative, which is put together by the Association of Public and Land-Grant Universities that I mentioned to you before. The moving force behind this is a man named Peter McPherson. Peter, who I met when he was the president of Michigan State University when I was in the Big Ten, he used to be Undersecretary of the Treasury during the Reagan years, and he was the head of USAID for some time, and then was university president, and now is the head of this organization. And he's an Africa hand for 40 years, and wanted to do something to build capacity of the higher education environment, the higher education milieu in Africa. So he got dozens of U.S. universities through this organization, APLU, which, as I mentioned, is over 200 public and land-grant universities, and dozens of African universities, and has us working together with some funding from USAID, some funding from the Gates Foundation, and hopefully more funding to follow from the United States government to develop partnerships between African and U.S. institutions where the direction is set by the African partners. And I've got the honor of serving as the co-chair of this effort for the United States, along with my colleague Silas Lwakabamba, who is the rector, like the president, of National University of Rwanda. And I was able to visit him in Butare. That was the reason I was in Rwanda. And there's an institution that lost half of its faculty and staff to the genocide in several weeks, half of the faculty and half of the staff. And yet they are pushing ahead with capacity building locally, and he is somehow finding the time to co-chair this effort where he is responsible for the whole African continent of bringing people together to link with American universities, and we hope in short order other developed country universities, because obviously there's huge expertise in many parts of the developed world to help develop the institutional capacity to solve problems in local communities and in local regions. The first priority fields that we set were, not surprisingly, in science and technology, agriculture, engineering, management, health writ large, very broadly, and teacher training, K through 12 teacher training. And we're doing advocacy and outreach. We've developed a knowledge center, an online knowledge center, and most importantly, brokering partnerships between people like Warren and people who have problems to solve locally. Cheryl Wu Dunn and Nick Kristof, you may have heard of them, of course. You've heard of Nick Kristof. And they are a first husband and wife team to win a Pulitzer Prize together for earlier reporting, and just wrote this book called Half the Sky about the plight of women around the globe. And if you don't have a chance to read the whole book, Half the Sky, read an article in the New York Times Sunday magazine about 3 months ago where they do a sort of a précis of the argument. Cheryl Wu Dunn is a Cornell graduate and a current member of the Board of Trustees. And if you want to read one single thing that very movingly and effectively summarizes the importance of women's health, going beyond maternal health, women's health in general, read this New York Times magazine article. And if you have the time, get Half the Sky. It's a very, very moving and effective argument why we need to put a lot of efforts into capacity building, aimed particularly at women's health issues. The New York Academy of Sciences, my wife, Professor Davison, one of the Weill Cornell professors, is on the board, a very active governor of the New York Academy, has developed a thing called Scientists Without Borders, obviously a play on the Doctors Without Borders. And they have a website and database, and they have hundreds and hundreds of people signed up to improve the quality of life by, once again, partnering, matching local needs identified by locals with expertise in other parts of the world. And Dr. Koh here at Weill Cornell moderated a recent symposium that the New York Academy had on vaccines for infectious diseases. I want to end, it's almost unnecessary to say this to such a motivated crowd as you are, but I want to say it anyway. We're hugely privileged to be in such a resource-rich environment. We're hugely privileged to be in the biomedical professions. There's no better place that I know about in a modern university to use our skills outside the walls of the campus than in global health. And it's an extraordinary opportunity to use our skills for the greater good. Thanks a lot for sharing the hour with me. Thank you.